clean my transducer as well as I can, because their immunities are low, so I don't want to take anything else to the patient. And I'm going to clean it afterwards because I don't want to take anything from that patient to my next patient. That's the same thing that you do if you have to go to the OR. If you have to go to the operating room, you want to don your mask, your gloves, your hairnet, your special clothing, your shoes have to be covered. But you also have to take care of your machine. So you want to take care of your machine before you don the equipment that you're going to need to go into the OR suite. Why? Anybody tell me?
Because the area is already a sterilized area.
Yeah.
So you don't take infection with you.
Correct.
In the area.
Okay? Because I don't want to clean a dirty machine in clothes that I'm going to the OR in. Okay? Because then all those germs that I just wiped down are going to be on my clothes, and I'm going to take them into the OR suite. As sonographers, we don't go to the OR suite very often. I think as a sonographer, I've only been up there 3 times, maybe 4. But if you work at MD Anderson, you're in the OR suite every day. That's one of the rotations. Ultrasound is a primary tool to use at MD Anderson. Okay, so you don't know where you're going to work. So OR might not be something that sonography does, and if you work at other facilities, that's going to be one of your rotations. Okay, some people like going to OR and some people don't. I love going to the OR. Gets me out of that hellhole downstairs.
In OR, do you just drape the transducer, or do you also drape the machine?
No. Okay, so if you go to the OR, then they have this long sleeve that's about this long, if not longer. Okay? The person that is sterile, you've already cleaned your machine, now you're in the OR suite. You're gonna hold it by the cord and you're gonna drop it into this bag and you're gonna step away. I don't want my hands to touch that bag. They're going to make sure that gel is already in that sleeve, because you have to have a conductor on this side and that side of the membrane.
Who is they?
The OR people.
Okay.
It's usually the OR tech, because you go up to the OR, you have the doctor or doctors, you have a resident, you could have a fellow, you have the OR tech, you have the charge nurse, you have the anesthesiologist. It's a whole group of people, okay? Just remember, don't touch anything blue. That's the easiest way to do it, is don't touch anything blue, because it's sterile. If you have to go around someone sterile, go back to back. Not front to back, but back to back. So some of the rooms can be quite small. Okay, so you don't ever want to reach over a sterile field. Like if they want you to pour saline into a container, you show them the saline bottle. You show them the expiration date, and you also speak. Normal saline expires 9/10/20. Okay, and then you open it, and then you pour a little bit out, because you don't know what's touched the edge, and then you pour it all into the container that they give you. The container they will move to the edge of the sterile field. So I'm not reaching over the sterile field to contaminate. Okay? Documentation is usually used for the radiologist or the gynecologist for paracentesis. They will dictate what they used. Every doctor is different. They might want to use a special needle. So that special needle needs to be on their tray. Most trays have everything that you need in that tray. Okay? But some doctors like their own stuff. Okay, so we cater to them and we give them what they need. Okay? It's our job to usually set up the room. So if I know I'm doing a histosonogram, it's not a sterile procedure, but we keep it as sterile as we can. Okay? A sonohistogram is just like a pelvic exam when you go to the gynecologist. They use a speculum to open up the vagina so they can clean with really long Q-tips. They clean the cervix and then all around the cervix. So whenever I want to clean something, I start here in circular motions and I go out. Never go over that area again. Okay? If you want to clean it twice, then you can go through and clean it with the second and then throw it out. Most of them have, I think, 3 sponges, so it allows you to clean it 3 different times. So it's usually going to be the sonographer. Oh, I was going to tell y'all about a histosonogram. So a histosonogram, the patient is in the lithotomy position, meaning they're either in stirrups or they're on a bolster, and they lift up their hips and they spread their legs. Okay? They go in there with the speculum, they open up the vagina, they clean the cervix, and then they put a catheter into the cervix, into the uterus. It has a balloon on the end of it, and it keeps the balloon from coming out. On that catheter, there's 2 different syringes to it. One for the balloon, and histosonogram, because ultrasound doesn't go through air, they've got to put a water into that balloon to keep it from coming out. Okay, not air, because air will mess up your exam. Okay, a lot of times the residents are brand new, so the sonographer has to almost kind of teach the radiologist what he needs to do. The other syringe will have a contrast in it, or water, okay? And then they'll inject that water into the uterus. The uterus is just 2 layers of tissue together because the endometrium is in the middle. It's just a hollow tube, okay? So as they put water in it, it fills up the uterus because the uterus can't expel the water except for through the fallopian tubes, and they can see the inside lining of the uterus. Because if there's polyps, you have dysfunctional uterine bleeding, okay? And we abbreviate that DUB. Radiology does the same type of it in an exam, and that's called a histosalpingogram because they use a different type of contrast to put into the uterus so they can see if the fallopian tubes are open. So if your patient comes in for infertility issues and they have ordered a histosonogram, they have made a mistake. Because the only way that insurance can pay for a histosonogram is dysfunctional uterine bleeding. Okay? So you might be responsible for cleaning the surgical site, But most of the time, the resident or the doctor will do that, or the nurse or the OR tech. Like some people have to be shaved if they're going to be in that area. Like if I did a big burly guy that's gonna have a liver biopsy, I'm gonna make sure that there's no hair there. But we have nurses that usually take care of that. We don't even have that type of equipment in our areas. Okay, if we need some. So, so when you have to do that, you don't want to touch it again once it is cleaned and it is aseptic as it possibly can be. Here they're showing how they drape a sterile field. You'll see this whenever you go up to patients' rooms and do renal biopsies, because we do those on the floor usually, bedside. And but you'll see this type of thing happen in interventional radiology. These are blue, so don't touch anything that's blue. When you open up the packets, pay attention to what they are, and you're going to open the packet in one long swoop. Okay? Don't bother detaching it, because if you detach it, there's a good possibility it could jump over into the sterile field. Okay? Just open the packet. Everything that's on that white tray is sterile. Do not touch it. If you have to pour betadine in there, because betadine will come in sterile packets, and some will use betadine out of a bottle. That's non-sterile. So if I were to do that, I'm going to pour it into that area that we're going to be using, and they can do that. Okay? I'm going to see, we have some mock sterile trays here. So probably tomorrow, we're going to work on gloves and sterile trays. This is how you put gloves on. You put your dominant hand in first, and you can touch the outer edge of this. Okay, this is now non-sterile where they're touching. So you slip your hand in, and then when you get the other glove on, you reach under this area to put on your other glove. Because remember, this is sterile. This is not sterile. Okay, so whenever I get this glove on, I'm going to take under here and I'm going to pop it over my clothes. You only get one chance. You can't mess it up. Okay?
You gotta practice.
You gotta practice. Yeah, you gotta practice. Okay? So when you put on your first glove, you gather the cuff. You gather underneath the cuff. You put on your other leg, your other glove. And then whenever they're both on, then you can do the rest. See what they're doing here? Okay. And so you only get that one little chance to pop it into place. They want you, if you're doing a sterile gown, they want you to cover the elastic bandages at the ends of the screws. Okay, so here is the probe that we were telling you about. It's a sterile probe, it's long, so it covers the transducer and a lot of the cord. Okay? And then this is a sterile rubber band that they can use to keep the air gap out, because they're gonna take the air bubbles out of this before they put the rubber band to hold the transducer